Governor Ron DeSantis says there is another case of coronavirus in Florida. What he's revealing about this new patient, plus what the federal government is doing to help the economy amid concerns over the illness. This third person to be diagnosed with COVID-19 is isolated in Hillsborough County. Good afternoon, I'm Vanessa Eccles.
And I'm Greg Warmoth. Health officials say we still have no cases of coronavirus here in Central Florida. Channel 9's Lauren Seabrook has been extensively covering this ever-changing virus for us, joins us live in studio. And Lauren, the state says a lot more people are also now being monitored.
More than 200 across the state, Greg, and these are mostly people who have recently traveled to countries where the coronavirus is widespread, but there are some in isolation simply because of the symptoms they're experiencing. As the coronavirus spreads across the globe, another case of COVID-19 in Hillsborough County brings the total in Florida to 3.
It is the sister of the young female who traveled back from Italy. She was also traveling back. She has been in isolation since this was all identified.
The two women in their 20s and the man in his 60s are all under medical care in the Tampa Bay area.
There is a roommate in addition to the sister who is in isolation, has not been symptomatic yet, but obviously that's something that's monitored.
And actually, the State Department of Health says 247 people are currently being monitored in isolation here. That's up by more than 50 people since just yesterday. Tests are still pending for 16 of them.
If you don't have an underlying health condition and you're not elderly, so far, you've seen very few really serious cases.
Governor Ron DeSantis says the latest woman who tested positive here is actually a California resident. So he says technically she won't count as a case in Florida.
But she is being isolated in Florida, and so it will count on the CDC's statistics as a California positive, but she is currently in Florida under self-isolation.
And state health officials expect even more people to test positive, especially now that the CDC has expanded its testing process. For Eyewitness News at 5, I'll be putting together a story about why some people who have been sick might want to go back and ask for testing again. Greg.
All right, thank you, Lauren. Amid this mounting economic fear from the COVID-19 virus, the Federal Reserve today lowered interest rates by 0.5%. That announcement comes as the head of the World Health Organization says the death rate of the coronavirus may be close to double what officials originally thought. And as ABC's Megan Tevrizian reports, officials have confirmed a second case of the virus close to New York City, prompting some school closures there.
Another case of the coronavirus hitting close to New York City. Officials confirming a second reported case in Westchester County, calling community spread inevitable.
You cannot contain the spread. You can slow it, you can limit it, but you can't contain it.
One of those confirmed cases, a man in his 50s, is now hospitalized in serious condition. He regularly commutes to work by train through Grand Central Station.
The best defense remains good hygiene. It's worth knowing that health experts say you should go about your lives as usual.
The number of cases is now more than 90,000 worldwide, and with more than 3,100 dead, the World Health Organization putting the global death rate from COVID-19 at 3.4%. For comparison, the flu kills less than 1% of those infected. In the U.S., the death toll has risen to at least 9 people. The TSA directing airlines at 280 airports around the world to ask U.S.-bound passengers about recent travel to China and Iran.
There will be additional countries, I'm sure, as we continue to work with the task force, and I think those announcements will be relatively soon.
The Fed cutting interest rates by 0.5%.
My colleagues and I took this action to help the U.S. economy keep strong in the face of new risks to the economic outlook.
But the move seeming to spook the stock market, the Dow dropping dramatically.
Megan Tevrizian, ABC News, New York.
The director of the National Institute of Infectious Diseases says a vaccine is likely a year away at the earliest, but noted there are a number of treatments being tested that could be available within months if they are proven to work. And some people who are planning to travel by train in the U.S. are being given the opportunity now to change their plans because of the coronavirus. Amtrak says it's now waiving change fees on reservations. The railroad service says it's not facing any travel restrictions because of the outbreak, but it understands customers may have concerns. The waiver applies to tickets purchased before April 30th.
The coronavirus outbreak is now also affecting how fans interact with players in the NBA. The league sent a memo to players over the weekend warning them not to high-five strangers and to avoid touching items for autographs. That includes pens and markers, balls and jerseys. The NBA says the goal is to lessen the risk of players getting the virus. Well, now the symptoms of the flu and coronavirus are similar, so we talk with a physician about the differences and when is the right time to call your doctor. We're putting together that part of the story for Eyewitness News at 4:30, and you can find resources and all of our coverage on WFTV.com. We have created a special section of the website dedicated to COVID-19. You can find it by clicking the coronavirus banner at the top of the homepage. And Thursday night, we'll be here to answer your questions about coronavirus live and give you the accurate information you need. We've assembled a team of medical experts and local government leaders to help keep your family safe and keep you prepared. Send us your questions through social media and our radio partner, News 96.5 WDBO. Coronavirus, your questions answered live Thursday at 8 p.m. here on Channel 9.